This FedGov Today program is sponsored by Maximus. Federal agencies are sitting on $100 billion in savings. The Government Accountability Office says the savings could come from cutting duplication, fragmentation, and overlap. Jessica Lucas-Judy is Director of Strategic Issues at GAO. Jessica, welcome back. Thanks for joining me. First, what's the difference among those terms? Duplication, fragmentation, and overlap.
Well, fragmentation is where you have multiple agencies or different offices within an agency all working towards a goal, and maybe they're covering different parts of it. Overlap is very much what it sounds like, where they're doing similar services or serving similar populations. And then duplication is the easiest one to understand, providing the same services to the same population. Now, just because there's fragmentation or overlap or duplication, that by itself doesn't necessarily mean there's a problem. What we're looking for at GAO is where it's causing inefficiency, confusion, where it's not clear who's doing what, and we make recommendations to try to address those things.
You do this work annually. You collect all of this work that you've done over the course of the year and produce it in one form. Mm-hmm. This is the 15th time that you've done it. What are the trends that you've seen historically, and what are the trends or commonalities among the things that are included in this year's work?
Well, as you said, we've been doing these since 2011, and in that time we've made more than 2,000 recommendations to Congress and to executive branch agencies. And I'm pleased to say that agencies and Congress have been able to address, or at least partially address, a little more than 3/4 of those recommendations. And some of the things that we continue to see, again, is sort of the misunderstanding or lack of clarity around who's accountable for a particular program or service, being clear on involving stakeholders and making sure that they're getting the appropriate input, monitoring for outcomes. So, figuring out who's doing what is it you're trying to achieve, how are you doing, how are you going to measure it, how are you going to know when you got there. And so one of the things that we highlighted in this report, as well as in our report recently on the high risk list, is the need for agencies to implement collaboration practices that we identified.
What are some of the mechanisms that you've seen agencies put in place that have led to success, or maybe things that are happening government-wide, vehicles that are coming from the Office of Management and Budget or other places?
Having good coordination. Sometimes that might be an actual coordinating body, making sure that they have good communication, having similar shared understanding of terminology. We have several of examples of that in this year's report. One on training, where you have two different agencies that are delivering two different kinds of training, and then when they try to get together to actually deliver the service, they're not communicating effectively. They don't understand what it is that they're trying to do. And so that's one place. And having sometimes a strategic plan, again, laying it all out. Sometimes agencies tell us that they're coordinating informally, but they're not really necessarily, it's not documented anywhere. And so, if one person leaves, you don't have that kind of continuity. We had several recommendations in this year's report around making sure that they're doing after-action evaluation. And so with the federal MPOX response, for example, we saw some of the same problems with communication, lack of communication, and not understanding, the roles and responsibilities that we had seen in earlier disaster and public health emergencies. And so we recommended that they make sure that they're doing lessons learned across all the different components of Health and Human Services and the other agencies that they're working with to deliver a better response.
And that kind of anticipates what I wanted to ask next, and that is how often, I guess, do you see agencies or one agency falling into the same issue that another agency had in a similar area? Is that something that you see on an ongoing basis across government?
I would say so. I mean, a lot of the problems that agencies are trying to address are very big, and they do require multiple agencies, whether it's the disaster response is a good example of that, where you have the housing and urban development that's in there, you have obviously the health response, transportation, and others that all need to come together to address the problem. But again, if they're not really all on the same page, then they're not able to deliver the services effectively. Some of the other recommendations that we have in here don't fall into that duplication, overlap, and fragmentation bucket. They're pure cost savings, places where agencies could do things more efficiently or better collect revenue, and so that's where a lot of the savings come from. One of the ones that's been in here for a number of years is on Medicare. We've recommended that Congress allow or direct Health and Human Services to equalize the payments for Medicare, whether the services are provided in a hospital outpatient facility or in a doctor's office. It's the same service. It might even be delivered by the same doctor, but the payment for it is different. So we said if they equalize the payment rate, then that could potentially save more than $150 billion, according to the Congressional Budget Office.
How many of the recommendations that you make are things that agencies can do on their own, and how many of them are things that they need to go to authorizers and appropriators and either ask for money or ask for authority to be able to do?
Most of the recommendations in the report are things that are within the agency's control. We make the recommendations directly to those agencies. Occasionally, we'll make a recommendation that they work with Congress and come up with a legislative proposal, but most of them are things that are in the agency's control. We do have a number of recommendations in the report, such as the one that I just mentioned, that are directed to Congress. It's a smaller number overall, but those tend to be a lot of the ones that have the big savings.
What are the ones that you've seen over time that have gotten better? And what are some of the ones that you've seen over time that don't seem to be getting anywhere?
That is hard to say. I mean, I think all of the agencies that we've looked at have made some progress. Obviously, DOD has the largest number of recommendations, in part because that's where a lot of the money is, a lot of the spending, and they have, lots of different opportunities to get together and better collaborate and coordinate. But we've been able to work really well, I think, with a lot of the agencies that we work with over time to help them understand where we're coming from with the recommendations, why we're making them, and we've seen a lot of progress. And as I said, more than 3/4 of the recommendations have been implemented.
And on a tactical level, how do you track them year after year after year when you're following the same things, but also adding new things in that either Congress is asking you to look at, or I imagine there are things that you discover in the process of doing other work where you say we should probably keep track of that also?
Yeah, we do meet with agencies on a regular basis. We're required to update our recommendations at least once a year, but we tend to do it more often. So we'll follow up, we'll ask what progress that they've made. Of course, we're GAO, we look for documentation, we want corroboration, we want evidence that they've actually fully implemented the recommendation and not just said, oh yes, we plan to do that. So that's one of the ways we do it. We also, the Comptroller General sends letters to the heads of each agency each year, highlighting recommendations that he thinks are specific priority or high priority for the head of the agency's personal attention. So we're in the process of putting those out right now. We also work with Congress on a regular basis, particularly, as I mentioned, the high-risk list. That's something that GAO puts out at the start of every new Congress to help them see where there are opportunities for programs that are at high risk of waste, fraud, or abuse or mismanagement.
We have about a minute left, and you kind of got to where I wanted to go to finish up, which is how are you laying the groundwork for the 16th time, which will come out, I imagine, about a year from now?
I keep hoping that maybe we're not going to be able to do these reports.
You won't have enough work anymore.
But each year, we do continue to find ways that agencies can work together better. So, what we're doing, again, is, continuing to communicate with the agencies on a regular basis, putting out reports like this, work with Congress on legislation, and, trying to continue to make progress.
It's great to have you here, Jessica. Thanks for joining me today.
Thanks so much for having me.